So our final session for this morning is from Stephanie Lyons and Dr. Debbie Smith. And Stephanie successfully completed her MSc and she's about to embark on her PhD, first year PhD, which is building upon the work that they're going to present today. So I'll hand over to you both. Thank you.
Thank you very much. Can you hear me okay at the back? And I'm not being a mean supervisor today. I am going to start the presentation and then hand over to Steph. I thought it was a bit mean a week before she actually starts to just say, go on, do the presentation, it's live streamed, go on, off you go. So we're going to do a little bit of a double act today. So I was just saying to Gail, follows on very nicely from the previous talk, because we're actually going to be talking about this group of women who have a BMI of 30 or more, and we're going to be focusing in on breastfeeding. So what we're going to do is we're going to give you a little bit of a background in terms of why we're interested in focusing in on this group of women. Why is breastfeeding behaviours so important for women who start their pregnancies with a body mass index of 30 or more? I'm going to be preaching, to people who know, so I'm going to do that very, very, very briefly. And then I'm going to give an outline of a programme of work that we've been doing, just been doing it a year now, mostly at the University of Manchester, but also with some collaborators up at the University of Stirling. So I'm a health psychologist. I'm interested in how people make choices around behaviours. And you'll see for this research, we do have midwives involved as well for Stephanie's work. So we're going to talk about some patient and public involvement work that started off this work, and then Stephanie's master's and then her PhD work. So, as I said, really brief slide on this because I know you all know this stuff. Breastfeeding is associated with lots and lots of benefits for child and mother in particular. A few bits there. I'm a university lecturer. I couldn't do a presentation without making sure my story flowed. And you'll see that I colour coordinate. Luckily, Manchester has a nice colour of purple, so anything that's in purple are meant to be the key bits that always I want people to take away from slides. So it's got lots of benefits. We know that. We know that there are recommendations in terms of breastfeeding. We've got the World Health Organisation's recommendations around that 6 months exclusive breastfeeding and continuing up to around two years. And that's important for this talk because I'm going to come back to that in a little bit when we talk about what the women told us about their experiences of breastfeeding. And then we've heard quite a lot today about the Baby Friendly Initiative. So we've got these things in place to help us encourage and support breastfeeding. But in the UK, we have, as you know, very low rates of breastfeeding up to that 6 months exclusive point. And what some of you may not know is that we have even lower rates of breastfeeding initiation and maintenance for women who do have a BMI of 30 or more at the start of their pregnancy. So that's where we kind of became very interested in this population. At Manchester, we've been doing, over the last 6 years, quite a lot of work around lifestyle interventions for women who start their pregnancies with a BMI of 30 or more. And what we were seeing it wasn't something we were measuring, but we were noticing that a lot of these women weren't intending to breastfeed or go on to breastfeed. So that's why we really kind of looked at this literature and thought, oh, we need to look into this a little bit more in terms of their choices around behaviours and how we can perhaps support them to make those choices. I've pretty much just said most of this really. There is a lack of research out there on this subgroup of women in terms of their initiation of breastfeeding behaviours and also then their breastfeeding maintenance as well. And the research that is out there tends to focus in on the barriers. What things do they find hard and what things stop them from initiating breastfeeding and continuing to breastfeed? We kind of sat there and thought, what about those that successfully breastfeed? What about those women that do this very well? Why aren't we hearing much about their stories? What could we learn from them? So last summer, we started off this programme of research by sending an advert out to try and find women around Manchester who had a BMI of 30 or more at the start of their pregnancy and had or were successfully breastfeeding. Because we wanted to kind of talk to them and ask them about this and kind of say, right, we're interested in researching this. How do you think we should do this? What's of interest to you? We sent this advert out, and literally the end of the day it had gone out, I was inundated with emails from women saying, yes, that's me, please, please, please talk to me. I really want to tell you how I've done this well. So we picked 7 of these women just randomly because we thought, as much as we want to talk to all of them, we physically can't. So we spoke to 7 in 2 groups, and we just kind of, Steph was there as well, and we spoke to them and just said, right, this is the story, what can we do about it? And majority of them were saying, you know, there are issues associated with breastfeeding and our BMI. It does need to be looked at. It is something, you can't just be saying, no, 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 it's the same picture for all women. It is something around that, so you do need to be looking at us as a subgroup. They also talked a lot about health professionals, and they talked about a lack of information. They talked about body image stigma. So we thought, oh yeah, there's a lot of things here that as psychologists, maybe we should be exploring in a bit more detail. So we realised that we needed to move this on and actually do this as a qualitative interview study so we could find out exactly what they were saying about these issues and what we could learn from that. So for Steph's Msc project over the last year, we did exactly that. We had this research question here at the top. What can we learn from women with a body mass index of 30 or more who have successfully breastfed and or are currently breastfeeding? So we aimed to get that group of women to find out more about what they were doing. So our exclusion criteria for our participants were they had to have a body mass index of 30 or more at the start of their pregnancy. They had to be a self-reported successful breastfeeder, and obviously we spoke that through them to check they had actually initiated and continued breastfeeding. And they had to be aged 18 to 45. We did online recruitment, so all of those women who had contacted me before about the PPI study, I went back to them all and said, oh, now we're actually doing it as a study, who wants to be involved? And we recruited very, very quickly as well, didn't we, to this study? Again, showing the women's keenness to kind of talk to us about this. We conducted telephone interviews. Again, it was something we asked the women in the PPI groups, you know, would you rather us talk to you face to face or would you rather on the telephone? And a lot of them said, well, you know, I might be breastfeeding, I might have my children there. Actually, if it's on the telephone, it's just going to be easier for me to commit to an interview. So that's why we decided to do telephone interviews, because we knew these women would have possibly their babies there as well. We designed a semi-structured interview guide based on what the PPI women had told us and also what the literature was telling us. And we actually sent that interview schedule to a couple of the women who had been involved in that group last summer to ask them what they thought about it. And Steph piloted it with one of those women as well. And we did, like the previous talk, I was saying it's great because it follows on so nicely, we did inductive thematic analysis. So what we did is Steph and I analysed these transcripts separately and then came together to discuss the themes. We had 18 interviews, and on average they were 42 minutes in length, so they were quite meaty, weren't they, the length of the interviews. We did 16 interviews, and then we stopped and we realised that nothing new was really coming out of the interviews. So we had a chat about the themes, and then Steph went away and did 2 more interviews, and we came back and we could agree that something called data saturation was met. Nothing new was coming out of this data set, so we could be happy that that sample size was telling us all we wanted to know from this group of women. Steph asked them just during the interview about the length of time they breastfed, and the shortest length was 4 months, and then there was still some women still breastfeeding, and the longest one there was 3 years old and she was still breastfeeding. So we had a nice range in terms of women breastfeeding. We're at the stage where obviously Steph just submitted this, and we've just been discussing all the findings, and we're soon going to publish this. So we have 2 preliminary themes that we wanted to share with you today. The first one is breastfeeding as a natural behaviour, and the second one was realistic expectations lead to success. And I'm going to go through both of those now with you. So obviously we were looking at these women's stories and trying to understand what we could learn from them to help other women make these choices in the same way that they have in terms of initiating and maintaining breastfeeding. So the first thing we found is that all of the women used the words natural and normal when they were talking about their plans to breastfeed and also their breastfeeding behaviours. And following on from Gail's talk then, all of them spoke about how their pregnancy had been risky because of their BMI. They all spoke about the complications that some of them had actually suffered and all the complications they thought they could suffer. And they all talked about how this risk that surrounded their pregnancy made them feel like they had a lack of control over behaviours that surrounded their pregnancy. And for a lot of them, they said, you know, I can fully understand why a lot of women would think, oh, that means I can't breastfeed. Everything else has been so risky and control taken away from me. I can understand how they wouldn't want to breastfeed. And a lot of them spoke about it made them stronger in terms of being more motivated to want to take control over that breastfeeding behaviour because so much other control was taken away. And I have a quote, don't I? A quote is, I think a lot of larger women feel self-conscious about their bodies anyway, and any additional reason for people to look at them like people do when you're out breastfeeding in public might stop them. So here's an example of our second thing that they said. They talked about social and emotional barriers. They talked about how being out in social situations, breastfeeding and having a high BMI, really said it could be such a barrier to people. And they had to feel like they had to really overcome those barriers to successfully breastfeed. And the majority of the women actually spoke about two things here. They spoke about their body size, but a lot of them spoke about the size of their breasts. And they said, you know, some other women may sympathise if they're very slim but have larger breasts. And the majority of them really focused in, didn't they, on the practicalities in terms of clothing as well. They said clothing for my size breasts in terms of nursing tops is just not possible to find. And the last point here underneath this top theme was about needing to normalising breastfeeding for these women. And again, fits in with that last theme there. But they talked about how it didn't feel like something that was comfortable to them. It didn't feel like something society made normal. And they talked here about the need for support and advice. In particular, they talked about peer support. And there's a quote here, peer support definitely normalised it. And we found that the majority of the women had been given peer support, but also now were feeding it back because they all said, I'm being so lucky that I've been able to achieve this. I'm now making sure I do support other women as well. And the second theme that we found was around realistic expectations lead to success. And we found that a lot of the women, based on the fact that they did say they felt like they didn't have support and education that actually focused on their experience. They talked about how often the midwives gave them options around positioning, but they said, for the size of my breasts and for the size of my body, I didn't find that positioning very, very comfortable. So a lot of them did feel like they didn't have tailored support and education for them, and that made them feel like they had quite unrealistic expectations in terms of what they would do. And a lot of the women talked about having those unrealistic expectations could really stop people from continuing breastfeeding. If they weren't met at that early stage, they could see that as a barrier to stopping them continue. And they also talked quite a lot about this relationship between postnatal weight, nutrition and breastfeeding, and they felt like they weren't really that knowledgeable about how the three fitted together. And they said there was so much conflicting advice, which they said for a lot of them led to really unrealistic expectations about weight loss in particular and how much they could or couldn't eat when they were breastfeeding. And again, they spoke about having to overcome that by finding out this information themselves to actually be successful breastfeeders. And the last thing that quite a few of them did focus on a lot was this issue of breastfeeding being a process. They said that the way they felt breastfeeding was kind of portrayed to them was it was all about that latching stage. And for several of them, they said, yes, it was very important, but it was actually later on when I wanted a bit more support. And for a lot of them, they really talked about how those parts were important, but they wanted it to be seen as that longer process where they got this peer support, or they got support and advice throughout the stages. So just in discussion and pulling that part together here, as I said, we are preparing this for publication at the moment, but some of the brief discussion points we're coming out with at the moment is there was a real thing around women wanting to feel in control of their breastfeeding behaviours. And for this group, it was particularly important because they were labelled, as we just saw in the previous talk, as a high-risk group, and they did feel like control for a lot of decisions and behaviours around pregnancy were removed from them. and very much about increasing those realistic expectations, mostly based on training. And that's where we're kind of moving now with the next parts of this research in terms of how, as psychologists, these things that we just saw here, they're psychosocial factors. Steph's going to talk more about this in a moment. How can we use those to help people make decisions that are going to help them initiate breastfeeding or maintain their breastfeeding behaviours? So that's what we want to do next, utilise those factors in terms of putting it together in training packages. And as the first speaker earlier this morning talked about, family-friendly and midwife-friendly packages, we want to focus in on all of those groups of people because it seems like there's a lack of education on both kind of sides. And body image and confidence is something that's come up in the last presentation and this one here as well, something that needs to be included here in some way. So that's my brief outline of the MSc. I will now hand over to Steph to tell you about what we are planning to do next from this.
So, hi, I'm Stephanie Lyons, and I'm going to just talk about the PhD that I'm starting next week. So, firstly, it's a 3-year PhD, and it's at the University of Manchester. And I'm going to be funded by the Economic and Social Research Council. My supervisors are Debbie Smith and also Sinead Curry and Professor Dame Tina Lavender. And the main work that I'll be doing on the PhD is continuing this programme really and hopefully resulting in the design of an intervention to increase breastfeeding in women with a BMI of 30 or more. And that would be increasing initiation and maintenance. Also, although I won't be doing it as part of my PhD, there will be, hopefully, the design of an intervention for health professionals to help them support women better as well, to help them increase the breastfeeding rates. So the main reason I'm picking this intervention is because so far there's been a real lack of interventions designed for this particular population, and the majority of them have been unsuccessful. And also, no interventions so far have utilised psychosocial variables, which I'll talk a bit about in a minute. And clearly there's a lot of room for improvement, so that's what I'll be doing. So my research question is going to be, which psychosocial factors increase breastfeeding intention, initiation and maintenance in this population? And this is just an example of some of the psychosocial factors that might be important and included in the final intervention. So body image we've spoken about. Oh. Yeah. So body image, yeah, we've spoken about that one already. Whether they feel like they're in control and whether they can actually breastfeed, whether they believe that they've got the ability to, and whether they feel that breastfeeding is the normal behaviour for that population, their expectations we've spoken about, and also whether they feel confident and supported to breastfeed successfully. So to answer the research question, I'll first be conducting a systematic review, which will hopefully identify some of the relevant psychosocial variables and theories that I can use in the intervention. At the same time, I will be setting up a permanent PPI group so they can be involved at all stages of the research and really help me make sure that this is good and that it's going to work. So then the next step will be designing the intervention itself, which will hopefully be successful to increase breastfeeding intention, initiation and maintenance. And the main test at this stage would be to test the intervention's suitability and acceptability, because if it's not acceptable and people don't want to do it, it's not going to work. So just to summarise, Debbie quickly ran through the research we've done up to now, and I've just quickly outlined the PhD that will be carrying it on in the future. If you are keen to be involved, please contact us on either of these email addresses, and we'd be really glad to hear from you. So thank you for listening. Are there any questions?
We want midwife input as well as our PPI group input, so please do email us if you're interested in this area.